Okay, so we are just going to start the live now.
Yes.
Hello and welcome to all. This is Ankani, the assigned moderator from IJCP Group. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors. Thank you all the doctors for taking out time to join us today. And now I'm taking this opportunity to welcome today's master doctor, none other than the eminent speaker, Dr. Ratan Jha, sir. Sir is the senior nephrologist and transplant physician at Care Hospital, Banjara Hills, Hyderabad. Now, with the help of Dr. Ratan sir and his wonderful insights, we'll be taking a close look on today's topic, which is how to protect kidneys. Without any further delay, sir, I would like to hand over the session to you. Kindly proceed with your topic. Over to you.
Good evening, everyone. Today is celebrated throughout the world as a World Kidney Day. This is the second Thursday of the month. 14th March 2024 is a World Kidney Day. And on this day, we are going to talk about how do we protect our kidneys. So the talk is going to be centered toward the basic aspects of understanding of kidney care and why it is important. The World Kidney Day is celebrated every year on the second Thursday of March. It is a day for worldwide campaign. And the goals of this campaign on the World Kidney Day is to increase awareness of the importance of amazing kidney to our health and to reduce the impact of kidney disease and its associated problem worldwide. And hence it is quite appropriate for today's talk that how we take care of our amazing kidney. The logo of the World Kidney Day has changed. In the earlier logo, there were two bean-shaped organs with three colored lines. The red line used to indicate the blood, which is getting filtered. The blue line used to just denote the kind of water in the system which is there, and the yellow line used to denote urine, which is eliminated. So that was the earlier logo, but the recent logo has changed. In 2024, the logo has changed into a kidney, which is bean-shaped organ with multiple colors. The red color again indicates that the blood that is going to kidney. The blue color ultimately denotes the same thing, that it is containing body contains water, which is maintained by the kidney. And the green color has been incorporated in this logo to denote that the kidney care is also linked to the concept that we should have a care which produces less amount of waste and green energy. That is the thing that we have to have some kind of solution which reduces plastic waste and other kinds of items which are discarded in patients who are getting treatment on dialysis, which ultimately injures the environment. So the green concept has been included in that, and the yellow is basically denoting urine. So this has been incorporated that in the World Kidney Day.
Sir, am I audible?
Yes.
Sir, your PPT is not changing the slides.
So what to do then? Should we go back again and?
Sorry?
Should I go back again? Is it not moving?
No, sir. No, sir. That's not needed.
This logo is seen? World Kidney Day.
Yes, sir. Now it's changing.
Okay. So then let us see the next slide has changed.
Sorry?
Next slide, kidney health for all is there.
Okay.
Is it taking time to go? I'm not clear exactly.
Sir, kindly, yeah, it's changing. It's changing.
Okay. So there's a logo change on World Kidney Day. The earlier logo was containing only three colors, but the recent logo of 2024 has multiple colors, and one of the color which has been included in this logo is the green color, to have a concept of green dialysis or kind of green care, etc. That means that we are not trying to injure the environment by the waste that we are trying to produce in the care of such patients. So 14th March 2024 throughout the world is now being celebrated as World Kidney Day. And the the theme of this World Kidney Day 2024 is that kidney health for all should be available, and it should be a concept of advancing equitable access to care of such patients and optimal medical management. That is, person should have access to the evaluation as well as treatment, and this should be available to all the patients irrespective of their regional background and the financial status. So this is the theme of this World's Kidney Day, that is kidney health for all, but it should be available to everyone who should have an equitable access as well as optimal medical management. So we all know that when we talk about kidney is considered to be a bean-shaped organ, and we try to explain to our patient that by the term bean-shaped, it means a special kind of, say, rajma dal, which is available in our country, which is just like a bean shape. This is the shape of the kidney, and when we try to look at the kidney's architecture as well as the morphology, we try to evaluate based on this ultrasound scan or CT scan, MRI, to see that whether the kidney looks to be the same. But when we talk about kidney size to a lay person, we try to explain them that size of kidney is roughly the size of a mouse that we use for using our computer, that is roughly 10 centimeter length and 5 centimeter width. Then that is the rough size of any mouse which we use in our day-to-day practice when we are trying to run the computer. So size and shape is important, and this is the thing that we tell our patients to be aware of. So why is World Kidney Day so important for us? Because there has been a sharp increase of chronic kidney disease incidence throughout the world. It has got an appalling human and economic cost, that is the quality of life for the patient, and the economic impact to the family is quite huge, and even to the nation which is taking care of this. There is a widespread ignorance about what kidneys are and how serious is kidney disease, which is slowly reducing, but still a problem in the developing world. To simplify the statement, 1 out of 10 people are affected by kidney disease worldwide. That is, roughly 10% is the prevalence of kidney disease. In India, the prevalence of kidney disease has increased, and it is said that 1 out of 6 people, that is 17% of the population, is having kidney disease of some form or other. That is, it is a common problem. It has been reported to be the 8th leading cause of death, particularly in women. So kidney disease are quite rampant in women, and it has to be properly even focused for the women who may get neglected in our system. In India, the recent report of kidney disease prevalence, instead of 10%, has been reported to be 17%. That is, it is emerging as a very important threat to the nation. So for economics of the country is concerned, when they are talking about taking care of such patients by different kind of models of therapy which are free. Got stuck again. Is the next slide seen? So
No, sir.
this,
Yes, it's changing.
so what are the symptoms of kidney is shown in the slide?
Yes.
The one has to realize that in the early stage of kidney disease, there are no symptoms, and one can lose up to 80 to 90% of kidney function without any sign. So that is to say that if you are trying to go to make a diagnosis of kidney disease based on symptoms and signs, it is quite late. But one has to remember that early detection is possible and can prevent the progression of disease to a late stage and avoid costly medical treatment. Hence, it is very important that we are aware of how to evaluate it. Early detection is now considered to be very important for not only preventing the complicated therapy, but to save the life with a good quality existence. General facts of kidney disease, particularly chronic kidney disease, which is the term which is used when the disease is there for more than 3 months. One has to understand that when we talk about kidney disease, there are two forms of kidney. One is called acute kidney disease, which is a disease which starts and gets over within 1 to 3 months. If it is between 1 to 3 months, it is said that it is AKD, that is acute kidney disease, and when it is earlier, it is called an acute kidney injury. So the terms are a bit different. But we are talking today about the chronic kidney disease. 10% of adult population, we have already spoken, suffers from chronic kidney disease. And every year, millions of people die of complications related to kidney disease. That they do not die of kidney disease, but because of associated problems like heart disease, because kidney disease is considered to be a risk multiplier for cardiovascular events. Most of the patients who are having chronic kidney disease die of heart disease, particularly if they are diabetic. 90% of diabetic patients with kidney disease die of heart disease, and only 10% can reach a stage when dialysis is required. Treatments like dialysis and kidney transplant are so often not affordable. That is, even if that is available throughout the world, it is not affordable for many kind of patients, or they're extremely costly, which makes the patient less which makes the patient skip the therapies in between when they are symptomatically better. And when the treatment is being given free, it is heavily weighing on the public healthcare budgets. So the dialysis and kidney transplantation, though it is available, it is not a cheaper option. But of the two, dialysis and kidney transplant, probably transplantation is a cheaper option in our country, because that is a permanent solution for patients who have a chronic kidney disease which are reached end-stage renal failure. One has to understand that patient of chronic kidney disease, not all of them will require dialysis or transplantation. That is done only when the GFR or kidney function has gone below 10%. So when we talk about kidneys, one has to know that kidneys are located in the back, like as shown in the picture, that is on the below the rib cage, the lower rib cage, it is overlapped by the is overlapping the kidney, and hence when we get any pain in the kidney region, it is always in the back, that is below the rib cage. So what do the kidneys do is an important thing to understand, because that are the ways the patient can come to a kind of a doctor for evaluation. Our amazing kidney it does many kind of functions which are crucial for the body. Our life is at risk when the kidney functions do not happen properly. One of the important functions of kidney is to balance the volume of water in the body. That is, when you take a lot of water, the body doesn't require water, it comes through the urine. That is, it is removing the water. And when you take less water, the body tries to conserve the water, and that's why the urine becomes concentrated as yellow. So the body, the kidney ultimately balances the volume of water that is required by the body to remain in good health. The other important function of kidney is to filter the blood of all the impurities and eliminate the waste products like urea, creatinine, and many other things like uric acid and many other things which are the electrolytes. The kidney also produces hormones that regulate some important body functions. By the term hormone, we mean that it produces some kind of chemical substances which is produced in the kidney but acting at other parts of the body, and it is not getting transported by any kind of ducts. It is going through the blood. So that is how the hormone works. And these hormones which are produced in the kidney, like renin, it tries to control blood pressure. Erythropoietin tries to make blood, and vitamin D activated product try to make the bone strong. So there are three important hormones which are produced in the kidney, which has got an impact on the system beyond kidney, and these hormones are getting transported through the blood. So to revise what I said, the kidneys are vital. It's an amazing kind of washing machine which is filtering the blood 300 to 400 times a day. Our kidneys, we know, make urine. That the urine can be understood as a water which is getting removed from the body which is not required. It removes the waste an extra fluid from our blood, that urea creatinine. It controls our body's chemical balance, that is, we talk about electrolytes, sodium, potassium, chloride, magnesium, calcium. This chemical balance and the acid is a chemical is a chemical substance which is kept in the right range, and hence it is kidneys are considered to be an important biochemist for our body. It keeps the biochemistry in the right range. It helps to control our blood pressure by salt and water balance, as well as the renin, that is hormone dependent blood pressure control. It helps to keep our bone healthy, and hence a person who has kidney disease has increased risk of fragility fractures. And it is also making the red blood cell, so producing erythropoietin, which is acting on the bone marrow to produce blood. So these are the functions which can get affected when a person has kidney disease in different ways, and patient can come with different symptoms. Like if person not passing enough urine, he will have reduced output. If you're not able to remove the extra fluid and waste, it will have swelling. If it is not able to control the chemical substance, it can produce high potassium, low sodium, low magnesium, etc. If it's not able to remove salt and water, it produces increased blood pressure. And when it is not producing enough amount of vitamin D, activated form produces bone fracture. And when erythropoietin is not getting produced, it produces anemia. So patient can come with different symptoms at different stages of kidney disease, and he may not realize that this is because of kidney. The term kidney disease is usually used when the presence of kidney damage is there, or decreased level of kidney function is there for more than 3 months. And it is really a disease which affects both the kidneys. So when both the kidneys get affected, the waste cannot be eliminated anymore from the body and may present or get elevated in the blood, which is called uremia, and it may affect other organs. When the kidney has become damaged by more than 85%, that is below 15% of the kidney function, that stage is called kidney failure, where the person may require dialysis based on the clinical judgment. So when a stage of the kidney failure supervenes, when there is chronic kidney disease has become very advanced, treatment to make the patient survive are only two: dialysis, that is could be a hemodialysis or a peritoneal dialysis, but this is extremely costly, time consuming, recurring, and other option is to do a kidney transplant, but there is always a kind of organ shortage, and that makes the things difficult for many patients. So these treatment options are available. It is done, but we have to see that we prevent the chronic kidney disease and not to go to a stage when such costly therapies are required. So this is a very important slide for all of us to understand that every minute kidney gets roughly 1 to 1.2 liters of blood, which is flowing through both the kidneys. Out of this 1 liter to 1.2 liters, 10% gets filtered. That is, of 10% of 1 liter is 100 ml, or 10% of 1200 ml is 120 ml. So that is the filtration per minute, and that is also referred to as GFR, glomerular filtration rate. That is 100 to 120 ml per minute in a normal person. So this 1200 ml blood which is coming in the kidney, roughly 20% of the blood that is pumped every minute. So in 5 minutes, the whole blood circulates through the kidney. In adults who are having 7 to 8 liters of blood, this whole blood is getting into the kidney 400 times per day. That is, it is filtering the blood 400 times a day, both the kidneys in a normal situation, and hence it is called an amazing washing machine. It's working 24 hours, 7 days a week, and continuously. So the kidney for a lay person it is just only removing the waste products from our body. But for those who are slightly enlightened, it is not only removing the waste products, but it tries to produce many kinds of products like hormone, tries to retain certain products which are good for body, and that's why the kidney is versatile. It has many functions than the conventional concept of only removing the waste products like urea, creatinine, uric acid, etc. One of the important function of kidney is to remove excess fluid from our body, which is shown in a pictorial way, the water bubbles that is there. And when it fails to remove the excess fluid, body becomes swelled up. Swelling is a very important symptom of kidney disease in general, particularly leg swelling and the swelling around the eye, the periorbital swelling. So kidney tries to maintain the right balance of water in the body, and when it fails, it produces swelling, or sometimes it produces dehydration when it is producing a lot of urine loss because of failure to concentrate. So kidney can produce both swelling and dehydration, both because of the tubular dysfunction. So kidney concentrates the urine in a normal situation and dilutes the urine in a situation when a lot of fluid is there. So when the kidney disease is there, in the early stage, they fail to concentrate urine and they have more urine frequency and they pass more urine in the night time. But when the disease becomes advanced, they are not able to remove water and they become swelled up. So that is the fluid balance. The second function of kidney is to balance the minerals and chemicals in our body, which is shown pictorially in this cartoon. So the mineral and chemical balance means the common minerals which are maintained by the kidneys are sodium, potassium, chloride, calcium, phosphorus, magnesium. So these are the things which are kept in right balance as per the need of the body. And when the kidney becomes dysfunctional, these are the things which can get altered and can produce symptoms because of that. One of the very important function of kidney is to control blood pressure. People feel that blood pressure is a cardiac disease, but it is not the case. Blood pressure usually, even if there are no other apparent symptom, is a kidney disease in its origin in most of the situation. And kidney, we know that is producing an important hormone called renin from the JG apparatus, which is there in the glomerulus. And this has an important kind of impact on the blood pressure control. So we use the drugs which are antireninemic, like the ACE inhibitor, ARB, to protect the kidneys when person has high blood pressure. Kidney also helps to maintain the healthy bones, and this happens through activation of vitamin D that we get through the sunlight or through the diet. The vitamin D gets activated, first step in the liver and second step in the kidney, to produce an active form of vitamin D, which is called calcitriol, which helps to maintain the bones and has got many other functions in the body, like immune functions. A person who is vitamin D deficient has more risk of having immune dysfunctions, and that was one of the concepts of treating patients with vitamin D in the COVID times, because we know that Indians in general are having vitamin D deficiency because of the lack of sun exposure. So calcium, which is activated in the kidney, is acting not only on the bones, but it also has an impact on the teeth, etc. So whenever a person has a kind of kidney disease with calcium disturbance, the person can have both bone, teeth problem besides the immune dysfunction or risk of infection. One has to remember that even if one kidney is functioning, that is enough to keep the person's healthy. And that is the reason why in a transplant, many a times the persons who are in the family members can donate one kidney in case both the kidneys are normal. The kidney is having a kind of 1 million nephron each. That is a filter that one can visualize. That is 10 lakh filter in each kidney. And as a specialist, as we are looking at kidney and its filters, which is called nephron, the kidney care specialists, particularly physicians, are called nephrologists. Even one kidney is sufficient to keep a person healthy is very important. And many times people are born with single kidney. So this has to be also remembered. The person who has two kidneys and one kidney, both the kidneys are normal, they can donate to a family member who has kidney failure who will require dialysis. So the kidneys that we talked about, the functions, in case kidney do not work well, what happens? It has to remember that in the early stage of kidney, there are no signs and symptoms. So even if the kidney not started becoming weaker in the early stage, we will not get any symptom or signs unless we try to look for it. And hence it is very important that we need to do the blood or urine test, which are the only way to know the kidney disease in the beginning in people who are at risk, like patients who are having diabetes or hypertension or some other form of kidney disease like genetic disease. Kidney, when it becomes dysfunctional and it is functioning less than 10% of normal, that is called end-stage renal disease or kidney failure. And when the kidneys are no longer functioning, a person has developed kidney failure, dialysis or transplantation are the options that we discussed. So dialysis is a comfortable process. If it is planned, it removes waste products and unwanted kind of substances which are there in the body. And it is usually done through the AV fistula, though we have catheters in the neck to dialyze in patients who are in an emergency situation where the fistulas or the hand access is not made. So when we try to take the blood out and use a machine, it is called hemodialysis, and there are various forms of dialysis techniques to deliver the best kind of clearance of the blood. The other form of dialysis which are commonly done in a child is called peritoneal dialysis or home dialysis, but this can also be offered to adults. The peritoneal dialysis is preferred in child because child may not be able to cooperate with putting needles in a fistula, and the techniques becomes very demanding. So peritoneal dialysis has been found to be a better form of dialysis, particularly in pediatric age group. But in adults, there could be a personal choice to go for peritoneal dialysis or hemodialysis. Even if a person is a peritoneal dialysis, after a few years, that becomes weak, or that peritoneal access becomes weak, and one may have to go for hemodialysis. The last option in patient who are on kidney failure is kidney transplant, and that is the best option for people who are fit to undergo kidney transplant. But when we do the kidney transplant, we try to put a new organ in the body and we try to leave the old damaged kidney in situ. Normally, it is not removed unless there are reasons to remove it, like patient has infection or very big kidney like polycystic kidney disease, where there's not enough space to put a third organ in the body. The kidneys which are usually put in the lower part of abdomen in the iliac fossa. So we were talking about kidney disease and options, but why we are talking about kidney disease? Because kidney disease is a big burden for not only the patient's family, but for the whole society and the country. CKD is currently not curable. That is not cured, etc. So there is no treatment in the world which can cure it, etc. But patients of kidney disease can lead a normal life if they are treated early with the supportive treatment which are now available. CKD triggers many other health issues, particularly the cardiovascular disease, where many patients of chronic kidney disease do not develop a renal failure to require dialysis, but they die prematurely because of the increased cardiovascular disease or because of stroke. If CKD is not detected early enough, it is bound to progress to kidney failure that requires dialysis or kidney transplant to survive, and is a very costly option for everyone. What, therefore, we can do on this World Kidney Day of 14th March 2024 as a practicing physician? We need to become aware of the risk factors which are prevalent and how to reduce them in patients. We should be able to spread the word to family members, friends, and colleagues that these are the risk factors, and if you're having any of that, you need to get screened. You need to promote the kidney health for all, because that is the motto of this World Kidney Day. And you need to join the global World Kidney Day movement and celebrate it with all of us. So first question that when you talk about whom should we screen, who are at risk, or are we at risk? The most common causes of kidney risk are high blood pressure, diabetes, family history of kidney disease like polycystic kidney disease, obesity, age over the age of 50 to 60, and certain kind of this population who are more at risk, like Asians Southeast Asian who are having higher risk of kidney disease. So these are the important causes of kidney failure risk, and these things, if it is present, one must get evaluated by going to the doctor. So kidneys for kidney to keep it healthy, the 8 golden rules have been talked about, which is simple to understand and promote. First is to keep ourselves fit and active. That is, you have to do exercise. You have to be always not having sedentary ways of working. We need to do some form of exercise, and the type of exercise will vary based on the age. The second concept is eat healthy food to ensure good nutrition, good control of blood glucose if a person is diabetic, and weight. By the term healthy food will mean that we should take more kind of plant-based protein, fruits, vegetables, less amount of sugary substance, less amount of salt, and enough amount of fluid. We should avoid the junk food which contains a lot of fat as well as salt. The other concept is to monitor our blood pressure, because now we have plenty of machines available to check our blood pressure, and home BP monitoring is the thing which is being recommended to take care of blood pressure on a continuous basis. Eat healthy, but keep the weight in check. That is, you need to check your weight and see that if you are putting on weight, you need to see a dietitian, decide how to cut down your calories. Maintain a healthy food intake, and in this regard, we have to say that people have a feeling that they need to take a lot of water to keep the kidney risk low, but it has been found that taking more than 2 to 3 liters of water is not in any way helpful. To avoid addictions, like particularly smoke and even the drinks, which are ultimately going to be detrimental in the long term, because they add to the risk of different forms of degenerative disease. And the last 8th point is, do not take over-the-counter pills on a regular basis. You can go to pharmacist shop and take simple painkillers, but not make it a habit to take it on a regular basis. If you require a painkiller on a long-term basis, you need to see a doctor to why you are needing this, because that could be a risk for kidney in the long term. And move your feet for kidney health. That is, keep on walking, eat less and walk more, may be a good kind of concept when we are trying to take care of diabetes as well as weight. So last few points, that when you have kidney related elements, you need to ask your doctor or risk factor to check your kidneys. And particularly the kidneys needs to be checked if you have diabetes, if you have hypertension, if you are overweight, one of the parents are having family members are having kidney disease, or you come from a high ethnic group with high risk, like the Southeast Asians are at very high risk of both diabetes and kidney disease. By the term overweight, we mean that we may not be always able to remember that what should be our weight. It is said that simple formula is that whatever is your height in centimeter minus 100. Like if you are 150 centimeter in height, your weight should be 50 kilo if you are male, and 85% of this will be like you should be 45 kilometer if females, because that is a simple formula to remember, but there are many other charts to say whether you are overweight or not. Other way to be calculate overweight is look at the body mass index, which means looking at the height and weight ratio, and if it is your body mass index is more than 23 to 25, you are considered to be overweight. So what we talked about, the 8 tips for trying to protect our kidneys: to be active, eat a healthy diet, monitor and manage the blood glucose in case you are diabetic, monitor and manage the blood pressure in case you are hypertensive, ensure adequate fluid intake, that is 2 to 3 liters, do not smoke, do not take painkillers regularly, and get your kidney function checked if you are at risk. So before I finish, to reiterate that there are common myths and facts that we have put in the slide. One of the common myths is that kidney disease is a rare condition, but we talked about that 10 to 17% of adult population throughout the world are having kidney disease. So it is no longer rare. The second function of the kidney is that we will be able to pick up make a diagnosis of kidney disease based on the symptoms. But one has to realize that symptoms are quite late to appear, like swelling, passing less amount of urine, or anemia, or high blood pressure. Early stage of kidney disease are totally asymptomatic, and hence it has to be checked by a urine test and the blood test. The third important myth is that testing the kidney is a very long and costly process. But one has to realize that testing the kidney is very simple and it is not at all costly. It will not cost more than 500 rupees at the present day time by checking urine and blood test. If one is at risk of kidney disease, there nothing one can do is one of the concepts that there is no treatment that can reduce the kidney disease. But the reality is that we can protect the kidney by the common the therapies or common kinds of tips that we discussed, like controlling the blood pressure, controlling the blood sugar, doing regular exercise, controlling cholesterol, controlling the diet. These are the things which can slow down the disease progression and may not allow the kidney to go to end-stage renal disease. We are now having good drugs to slow down the disease progression. So it cannot cure it, but it slows down the disease. The fifth myth is that no one knows what causes kidney disease in many situations. Though it's true that 1/3 of patients in our country are having kidney disease unknown, which are blamed to because of toxins in the air, water, food. But that is only 1/3. The remaining patients are either diabetes, high blood pressure, or some forms of immune disease for which a treatment is there, or some form of genetic disease where we can give a proper counseling. So the disease, at least in large majority of patients, we are having cause known. The few people have a feeling that kidney failure means dialysis or transplant, but the kidney disease is, though it is progressive disease, not all patients will require dialysis or transplant in his lifetime. And once it is needed, it is still a safer procedure compared to no treatment. Once I started dialysis, it is not a lifelong dialysis for patients who are having acute kidney injury or acute kidney disease. So dialysis doesn't mean that it is long-term dialysis unless we know is it a chronic kidney disease which has reached the stage of kidney failure. Kidney damage is not caused by alcohol or smoke, but one has to understand that this kind of adulterated alcohol is one of the causes of kidney failure. Methanol, it can be life-threatening, or the alcohol may have other kinds of problems associated like hyperuricemia, which can predispose a person to develop metabolic disorders which can lead to kidney failure. And smoke is one of the worst forms of addiction which can have a detrimental effect in all people. And lastly, people think that drinking a lot of water is very good for the kidney in general, the myth. But the fact is that 6 to 8 glasses of water is enough to produce 2 liters of urine and remove the toxin. So taking more than 2 to 3 liters is not going to be beneficial, but it could be detrimental in the long term. And patient will pass a lot of his time in the toilet rather than doing the useful work. So that was all that I wanted to share on this World Kidney Day, that why we celebrate the World Kidney Day, but it is basically a day to make people aware that kidney is an important organ and it has to be taken care of as you take care of heart. And it can be protected by simple kind of method that we talked about, the ABCDs of therapies like A for hemoglobin A1C for diabetes, B for blood pressure control, C for cholesterol, D for diet, and E for exercise. So the concept of using ABCD concept is just to emphasize the point that we can control the disease, and we should always see the doctor in case we have any doubt about the kidney disease. We are now having 2 groups of patients. One is totally unaware, and the other is totally worried based on the Google information. So if we are at risk, we need to visit our doctor. That is the motto of my presentation. Thank you. Back to the organizer for any question if there is any.
Hello, sir. Am I audible to you?
Yes.
Okay. Thank you so much, sir, for comprehensive talk, and the PPT was so much informative. Sir, we have received few questions from our participating doctors. With all your due permission, can I put them across?
Yes.
Okay. The first question is, what are the renal implications of common comorbidities such as diabetes mellitus and cardiovascular disease, and how should the management be tailored to prevent kidney complications?
These days, we talk about a syndrome called cardiovascular kidney metabolic syndrome, because these three kinds of risk factors go hand in hand, because that is the change that has happened in a recent time when people are having metabolic factors like obesity, hyperuricemia associated with hypertension and diabetes, and a kidney disease as a consequence of all these factors. So these three broad factors are now put under a kind of coinage of CKM syndrome, that is cardiovascular kidney metabolic syndrome, which has to be appropriately targeted. Obese person, diabetic person, and kidney person are having a common kind of risk factors, and hence it is said that when we have a patient in this category, we need to see whether we are giving a goal-directed medical therapy for heart disease, kidney disease, and weight loss related metabolic disease, which is producing a problem of even liver disease in the form of this non-alcoholic steatohepatitis or NAS, which can lead to kind of liver failure. So this is a very complex thing, and but they have a kind of origin in the same risk factors, and hence it is a new nomenclature to be looked at in patients. More than 50% of patients will have, in our Indian context, a kidney disease with heart disease and diabetes and obesity.
Okay, we are moving to the next question, that is, what are the latest advancements in renal biomarkers and diagnostic techniques for early detection of kidney disease, and how can they be integrated into routine clinical practice?
Well, it is a good question that we are also looking for kind of biomarkers to make a diagnosis of kidney disease early. But the two common biomarkers which are utilized despite its inadequacy is looking at the urine albumin creatinine ratio, that is looking at the urine albumin along with the creatinine to see is it in the right range or not, and looking at the eGFR, that is estimated GFR based on the formulas after checking the serum creatinine. So these are two practical biomarkers which is still being utilized. There are many other research tools which are being talked about, but none of them have been found to be very accurate or practical. And hence, at the moment, we're looking for a biomarker, but we have no good biomarkers in general for picking out the patient early. So we have to combine the clinical factors, the risk factors, and these whatever simple tools that we talked about to use it adequately to make a diagnosis early. Maybe in the future we will have an artificial intelligence which will incorporate many of these things to predict that who is at risk of kidney disease even before the creatinine or GFR changes. So, but we are looking for it, but we are not having. We're still far away from making very early diagnosis. The earliest diagnosis could be made based on the risk factor patients being screened by the UACR as well as serum creatinine.
Moving to the next question, that is, how do medications commonly prescribed in clinical practice impact kidney function, and what strategies can be employed to minimize their nephrotoxic effects?
The, the nephrotoxic drugs that are common, known, and still being used are the NSAIDs, that is the like ibuprofen, naproxen, and maybe aminoglycosides, which are commonly prescribed. So these are two broad groups of drugs which are commonly prescribed by physicians, orthopedician, rheumatologists, pediatrician alike, and this should be avoided as long as possible, etc., and to be used for a short period of time in case it is a must. So besides that, the other nephrotoxic drugs are basically used in very high risk kind of patient, like in cancer patient, where many kind of drugs are there which are nephrotoxic, but they are given for saving the patient's life by trying to control the malignancy. So those are nephrotoxic drugs. There are certain drugs which are used, if not properly used, can lead to kidney dysfunction. Like, which are the best drugs? Like, for example, treating high blood pressure with ACE or ARBs, that is the common drugs that we use, like Ramipril or Telmisartan. They are good drugs for controlling blood pressure in many people. But if they are used in an inappropriate setting, when the person is dehydrated or volume depleted, they can produce a renal dysfunction, which is potentially reversible, but can produce a kind of problem. Similarly, the drugs like certain drugs like diuretics, which if it is not properly given, they are not nephrotoxic, that can produce problems because of dyselectrolytemia, particularly the thiazide diuretics and potassium sparing diuretics. So when we are trying to use a drug, if it's not used in right combination, if the right kind of monitoring, the drug can become kind of toxin or nephrotoxic or poisonous, etc. That is the simple way to take it. That if you do not use the drug in the right way, the drug could be harmful. Because any drug that you are using which has got effect could have a very serious side effect if it is not properly monitored. For example, the common kind of problem that we see in our day-to-day practice is the use of RAS blocker discontinuation because the side effects of creatinine going up or potassium going up, though that is one of the best drugs. So we need to know how to use the best drugs without risking the patient's life as well as the kidney. That's a simple statement to make. The three pillars of kidney therapy at this point of time for common disease like diabetes or for chronic glomerulonephritis related kidney disease is to use the good dose of RAS blockade for controlling the blood pressure, to use the SGLT2 inhibitor for reducing the proteinuria, and use the MRA of finerenone for slowing down the kidney disease and heart disease progression. So these are called the pillars of therapy. And whenever a situation arises to treat a patient's kidney, we need to see that we should tick the box of these pillars that have you used the drug or not. If you are not able to use this drug, at least you are not given extra kind of life of preventing the kidney disease progression. It is said that when you use the pillar 1 and 2, you get a life of at least 15 years without need for dialysis. And if you are using the third pillar, it could be 15 plus 5, 20 years extra life without using dialysis if it is started early. So these are three drug combination which is now being promoted as a kind of triple drug kind of therapy, if appropriate, to save the kidney and save the patient from the consequences of kidney disease like heart disease.
Okay, moving to the next question, that is, what are the key differences between acute kidney injury and chronic kidney disease, and how should they be approached in terms of prevention and management?
This is an important question. The acute kidney disease is because of different factors. The common causes of acute kidney injury in our setting is infections, drugs, common infections which can produce acute kidney injury. Like infections are basically kind of fever, viral fever, or a kind of malarial fever, dengue fever. These are influenza-related kind of problems, or even the COVID infection that was there. So the various forms of fever or infection can produce kidney disease. Other is because of drugs, like when we talked about aminoglycoside for treating infection can produce kidney failure. Sometimes poisoning, snake bite related to the kidney injury. Sometimes diarrhea, vomiting, dehydration, which was a common cause of kidney in the past, has become less common, but still it is there in pockets where the water sanitation is not good, but that is slowly going away. So factors which lead to a kind of fluid loss or blood pressure fall can produce kidney injury, like acute myocardial infarction can produce an acute kidney injury. So the causes are a bit different in acute kidney injury, which is potentially recoverable if it is treated early. Like patient who has diarrhea, vomiting, dehydration, and gets the acute kidney injury can recover completely or to some extent partially. One has to understand that earlier we were using a term acute injury to say that kidney has totally recovered, but it has been found that the causes which are leads to acute kidney injury, though symptom-wise it recovers, but may not totally recover. It is said that the commonest cause of chronic kidney disease is acute kidney injury in the world. That is partial recovery of AKI, which slowly evolves over time to produce chronic kidney disease. So AKI, the treatment of AKI is basically treating the cause and see if that is recovering or not, and looking at the residual things which are there after the cause has been taken care, like fever has gone away, patient diarrhea, vomiting has gone away, and then whether there's any kind of residual damage in the kidney, which may keep on increasing over time. The damaged kidney becomes more damaged over time, and that's why it's called AKI is the commonest cause of chronic kidney disease. Commonest cause of chronic kidney disease, other than the AKI, is diabetes and hypertension. So these are two top causes of chronic kidney in the world, which produces kidney failure, requiring dialysis in 50% of patients on dialysis. Like in our hospital, in our dialysis unit, when we see the patient, commonest patients who are requiring dialysis are diabetic, followed by hypertension, and then unknown causes which are there. There are a few other causes like genetic disease that you talked about, the ADP. The treatment of chronic kidney disease is basically a supportive therapy that you talked about, the three pillars of therapy to be utilized. And the other things that we talked about, the A, B, C, D, E. So like A for hemoglobin A1C, B for blood pressure control, C for cholesterol management, that is preventing heart attack risk, D for diet, that is reducing salt intake, reducing the kind of protein, animal-based protein intake, reducing fat, which may be harmful, particularly trans fat, and E is for exercise. People become sedentary, that may keep on putting on the weight and can have a detrimental effect on heart and kidney as well. So that is a concept. You have to use the different ideas in different ways and different cocktail to get to the best result.
Okay, we are taking today's last question, that is, what are the emerging therapeutic approaches and potential future directions in the field of kidney protection and regenerative medicine?
The the people are talking about the wearable kidney, artificial kidney transplant from the pigs. These are the futuristic areas where the things are emerging. But at the moment, still these things have not become operational. These things have been tried in the research lab, etc. And people are looking for having some kind of advances in our therapy to make the patient comfortable in case they reach the end stage renal failure, and dialysis is a kind of not a very comfortable process for lots of the patient. So if you are having a miniature kind of kidney, etc., which can be put on the body, that is a wearable kidney, it will make the life easier for patients. Similarly, for transplantation, where this organ shortage is there, people are talking about transplantation from the animal species, particularly pig is said to be most close to the human beings so far kidney is concerned. And despite having many kind of obstacles, that has become possible in the developed world in USA, but it is still not operational because there are certain areas which are still not fully understood. So these are the things which are emerging as a potential research tool, research areas where people are focusing to make the life of patients of kidney disease better. But till that time we reach that stage, we need to see that we screen the patient who are at risk that we talked about, that hypertension, diabetes, family history, elderly, using painkiller therapy or genetic history by appropriate tests that we say urine examination and blood test, and seeing the doctor once in a year, and avoiding painkillers in general on our own on a long-term basis.
Thank you so much, sir, for answering all the queries of our doctors. And I would also like to thank all the participating doctors for your continuous participation at our platform. Thank you once again, sir, for your valuable time and for being with us at our platform and sharing such valuable insights to our doctors. With all your permission, sir, can we just stop the live now?
Yes, thank you.